Good afternoon, everybody. My name is Eric Hesse. I am a security counselor at the Minnesota Security Hospital in St. Peter. The facility houses patients that are civilly committed as mentally ill and dangerous, along with civilly committed sex offenders. I provide counseling to patients, help to implement treatment plans, observe and document patient behaviors, and provide verbal and physical crisis intervention when necessary. I work in a maximum security facility, and in my facility and others across the state, violent attacks and assaults on healthcare workers are common. I was brutally attacked at work and nearly lost my eye. The incident happened after a recently transferred and highly assaultive patient began to continually attack other patients. I was assigned by doctors and administrators to what is known as a one-to-one, which I am tasked with monitoring the patient exclusively and have to be within 5 feet of them at all times. After descending a flight of stairs, the patient swung around and punched me in the right eye, causing me to instantly lose sight. I was rushed to the emergency room where they discovered I had a blowout fracture of my orbital bone and a popped sinus. I received 17 stitches, and to this day, my orbital bone is replaced by fatty tissue. I would like to say that my attack prompted changes that made the workplace safer, but that is not the case. Since my injury, there have been many other attacks, stabbings, a broken back, and a brain injury because a staffer's head was repeatedly bashed into a brick wall. She now suffers from seizures. In 2015 alone, our facility had 183 cases of staff being assaulted by patients, a 40% increase from 2014. 22% of our workforce has been impacted by workplace violence within the last year. Our union, AFSCME, filed a complaint with our state OSHA, and they levied a $63,000 in fines to the facility. Every day, my coworkers and I live with our injuries, but we are not punching bags, and getting hurt should not be part of the job. There are common sense measures that could prevent injuries. We need adequate patient to staff ratios, not the 30 patients to one staffer that we see now. We need access to tools and training that are proven to prevent violent attacks against healthcare workers and the clients we serve. We need to give input on facility designs because unsafe layouts have contributed to a number of documented assaults, including mine. I am proud of the work that I do. I know that serving in these facilities is important for the clients and the community as a whole. It is not an easy job, and it will not truly be 100% safe, but it's time for healthcare workers to get the protection we need to continue our important work. In Minnesota, AFSCME and our allies are taking on the epidemic of workplace violence against healthcare workers. We started a Facebook page called Safe Staffing Minnesota and have worked with Governor Dayton in his budget request for $177 million in funding to help address this critical issue. But this is not just a Minnesota issue. This is a national crisis. I deeply care about my patients, even the one that attacked me and my coworkers. But we need national attention, and we need it now. I know from my work that violence is predictable and preventable. It is time for OSHA to act. Thank you.